everybody. I hope you are here today to learn more about sleep and pain. This is such an important topic. I have so many patients that have problems with sleep, insomnia, sleep quality. They don't wake up refreshed in the morning. And I wish I had more time in my clinic to talk to them about sleep quality, how to improve this, what are the mechanisms that this happens. So this is why I'm doing this live today, to discuss with you about sleep and pain, especially chronic pain. But also this video will be archived on my YouTube channel, and then anyone can watch this topic later. So that's why I'm doing this here, because it's such an important topic. So let me start by thanking those of you who are here today. And I have some announcements to make before we start. So let me just, I'll copy in the chat here that everybody is welcome to this live YouTube session. And then I ask that you be polite today, and that you post your comments, your questions in the chat, and also that you introduce yourself in the chat, because that would be great if you can introduce and tell where are you watching from today. So say your name, the country where you are watching from. This is in the chat here. The chat actually gets archived as well. So when you were watching the recorded session of the video, you can read what people posted in the chat. So that's great. And so I am Andrea Furlan. I am a pain specialist. I'm a physician, doctor in Ontario, Canada. And I have most of what I do is helping people with chronic pain. And I love to share what I know. I love to share what I've learned about pain, chronic pain, over the last 30 years that I've been doing this. So today we'll be talking about sleep and chronic pain, and I'll give you some tips how to improve the quality of your sleep, because there are so many things you can do. So let me remind everybody that this live YouTube session is not intended to give anyone individual medical advice. It's just for educational purposes. And if there is a problem, an emergency while you're watching this video, please disconnect YouTube and go to the nearest emergency department or call an ambulance. And if you have a problem, individual problem, talk to your doctor, because I can't give you medical advice because I don't have all the details about your condition. So this is just for us to learn more about pain and sleep, especially chronic pain and sleep problems, okay? Because that's what I do. Okay, so let's start. Welcome, Susanna. Oh, from South Africa. Wow, thank you so much for watching today here. I'd love to hear where other people are watching from, and just type your name in the chat and where are you watching from. Lovely. Thank you, Susanna, for being here today with us. Okay, so what do you think is the prevalence, the number of people in the world who have sleep problems? Like anyone, not just people with chronic pain. So if you had to guess, like the normal population, including children, adults, older adults, what do you think is the prevalence of people that, if we ask a question randomly on the streets, if I go on the streets of every city in the world and I ask, do you have a sleep problem? What do you think would be the percentage of people that will say yes? Well, some people already have done this, and they have done this research before. And believe it or not, is more than 1/4. So it's more than 25% of people who would say, yes, I have a sleep problem. Now, when we ask people with chronic pain, so if you ask people who are living with chronic pain can be so many things. The definition, what is chronic pain, is that pain that remains. It's a pain that persists. It's a pain that is ongoing after some injury have happened, a disease has healed. Let's say a person had a fractured bone the bone is healed, or a person had a surgery and the surgeon says, you are perfect, I have nothing else to do. The x-rays or the MRIs, they show that everything is okay, but the person continues having pain for the period that persists after the normal healing period, the normal healing time. That's considered chronic pain. So the pain is ongoing, daily, after, and we consider this for some condition is after 3 months, for other conditions is after 6 months. And so then the pain persists, and not only persists, but becomes continuous, becomes like before, the pain was only when I moved, but now the pain is constant. And not only this, but the pain that was localized in a body part now becomes spreading. So chronic pain is a different disease. It's not the same thing as the original problem that caused the pain. Okay, so that's why we need to treat differently. Hello from Georgia. Hi, Roberta from Georgia. Lisa, welcome here from York region in Ontario, close to me here. Benny, hi Benny from Philippines. Donna from North Carolina in the USA, and Nick from Australia. Oh my God, it must be in the middle of the night for you, Nick. I hope you're not having insomnia right now. And maybe that's why you are watching this video. I hope that after this live session, Nick, you will be able to fall asleep like a baby, okay? So I ask a question. What is, if you ask people, regular general people, what is the prevalence of sleep problems? It's about 25%, a little bit more, that will say, yes, I don't sleep well. Now, if you ask people with chronic pain, what do you think would be the number? What do you think, what's the percentage of people that will say, yes, I have a sleep problem? Any guess? Well, there are a lot of research done on this, many different studies, and they vary. Like some studies find one percentage, another one find another one. So these percentages fall between 50% and 88, so almost 90%. So it's crazy. So if you ask people who are living with chronic pain, what is the percentage of them that have a sleep problem? Between 50% will say yes, to 90% will say yes. So depends on the pain clinic that you ask, and depends on the age of the population that you ask. But it's a lot. So 25% of the general population have problems with sleep, but 50 to 90% of people with chronic pain will have a sleep problem. And when we say a sleep problem, what do you think we're talking about? So any guesses? What do you think when we ask, do you have a sleep problem? What will people say is the sleep problem that they have? Any guess? What would they say? Think, yeah. So they will say it's insomnia. They will say it's poor sleep quality. They will say it's sleep insufficiency. What this means is they wake up in the morning, maybe they had enough sleep. They say, yes, I sleep 8 hours. I don't have insomnia. I sleep 8 hours. But when I wake up in the morning, I feel that I didn't sleep. I'm more tired than when I went to bed. I feel very tired in the morning. So that's what we call sleep insufficiency, poor sleep quality. Some people will say insomnia, which means they are tired, they are in bed, they know it's night, they were supposed to sleep, but their eyes don't close and their mind keep racing and they can't fall asleep. So those are the most common sleep problems. And there are other more rare sleep problems that people may have. So we will talk about today what are the important steps to take if a person is having sleep problems, okay? Because that's very common. We'll welcome Shabista. Hello. There is also someone from UK have twitch and jerking at night. Yes, insomnia. Yes, so don't know what is going on. Yes, so please talk to your doctor. Maybe order a sleep study. So that's my first recommendation for people with chronic pain that have a sleep problem and they're not sleeping well. When they come to me, the first thing that I do is I ask, did you have a sleep study? And if they didn't, or if they had a sleep study many years ago, I may need to repeat a sleep study. This means that they will need to go to a laboratory and sleep in the lab. I know it's not that comfortable. It's not the same thing as sleeping in your own bed, and especially because they will be putting some electrodes in your head to measure the activity of your brain while you are sleeping. Maybe I need to do a video about that. What is a sleep study? That I just had that idea. What does a sleep study do in helping us to diagnose problems? So a sleep study is very interesting because it can detect some biological diseases of the sleep itself. It may detect that the person has a sleep apnea, and there are different kinds of sleep apnea. There's central sleep apnea, which is a problem in the brain, or they may have obstructive sleep apnea, which is a problem that the trachea closes here when they are sleeping, so there is lack of oxygen to the brain. But central sleep apnea is another problem. It's different. It's a blockage in the brain center that keeps us breathing when we are sleeping, because when we are sleeping, most of our functions, our bodily functions, stop because we need to relax, but we cannot stop breathing. So the brain continues sending messages to the lungs and the heart. The heart needs to continue beating, the lungs need to continue breathing, but there are some diseases that affect this center in the brain. So it may cause the person to stop breathing when they are sleeping. That's central sleep apnea, and a sleep study will diagnose that. We also know that some medications cause central sleep apnea, especially opioids. Opioids are notorious. They are very famous for causing a person to stop breathing when they are sleeping, and the person can die. That's what we call, that's the mechanism of an opioid overdose. The person goes to sleep, the opioid blocks the center in the brain that makes them breathe. The person stops breathing, they don't wake up because they are sleeping very deeply, and they die in their sleep. So that's one of the mechanisms why people stop breathing. So the sleep study will detect those things. The sleep study will say, wow, you have sleep apnea, central plus obstructive. And there are also many other diseases like restless leg syndromes. There are narcolepsy, many diseases of the sleep. So it's really important to have a sleep study. Now, if the person had a sleep study, and let's assume that they don't have any problem, because sleep apnea has to be treated, restless leg syndromes there's a treatment for that. Let's say that the person did a sleep study and they don't have a disease of the sleep, but they're still not sleeping well. So what they can do, okay? So this is what we're talking here today. So we know that there are often associated things with a person that has chronic pain and a sleep problem, assuming that they don't have any sleep disease. And those are usually related to psychological, social issues, like those worries, preoccupations, fears. Those things keep ruminating in the person's head. There's also the pain itself, like the position that the person sleeps. Sometimes they wake up and they're in pain, but then they have difficulty finding another position, and then they turn to the other side in bed and it doesn't get better. So then this is what they call, they toss and turn the whole night. And so when they wake up in the morning, they are worse than they were before they went to bed. But insomnia itself is not related to the pain. Insomnia is a lack of ability to close your eyes and to fall asleep. So insomnia is related more to psychological, social problems, and there are things that we can do. Cognitive behavior therapy, CBT is cognitive behavior therapy, and there is CBT for insomnia. So we call that CBTI. It's excellent for this kind of insomnia, okay? But again, assuming that the person did a sleep study and they don't have any disease of the sleep. So there are those things, because insomnia is more related to psychological problems. Therefore, the solution would be more psychological, and CBT is a psychological intervention. Okay. Now, what about sleep insufficiency? Sleep insufficiency is the person doesn't have an insomnia. They are able to fall asleep, but their quality of sleep is not good. They don't wake up refreshed. We call this sleep efficiency. So, and this is both insomnia and sleep efficiency aggravate the symptoms of chronic pain. So you see how they are very much interconnected. There's two things, chronic pain and chronic sleep problems, they are very much interrelated. One causes the other and they aggravate each other, so they compound. So for people who have chronic pain, it is extremely important to get sleep hygiene very seriously. Take sleep hygiene very, very seriously. I have so many patients, I saw many of them recently, that they just give up and they don't pay attention to their sleep anymore. I feel so sad when I see these cases. I see teenagers who are doing this, and I see older adults who are doing this. I see young men, young women, middle age, and they are just giving up. Their sleep has a serious business. This is what I'm talking about. Because there are a lot of things that you can do if you want to improve your sleep. A lot. Let me tell you my own experience, okay? So I'll tell you here that I have always been a bad sleeper. Since my teenage years, I was always waking up in the middle of the night. I was even sitting. I woke up, I remember many, many times during my teenage and young adult years, waking up in the middle of the night and I was sitting. And I said, why am I sitting? I should go back to, lying down. I had no idea why I was sitting. I could even, when I went to hotels and camps, I could not sleep in the bunk bed, the below bed, because I would sit and hit my head in the bunk bed above me. And then I had a lot of toss and turn during the night, but I didn't have pain. It was just, I thought this was normal. And I said, this is the way I am, and never had a sleep study. And then I had kids. And when I had my children, it was even worse because, with the sleep routine and the kids don't sleep well and they wake you up, and then things even got much worse. And my sleep quality, I was always waking up tired in the morning, and I was always sleeping less than I actually needed. I knew I was sleeping less, but I had so many demands on my life, busy woman, busy mother, working as a doctor, studying for my Ph.D, and really, really didn't pay attention to my sleep. And then I started this YouTube channel in 2019, and one of my videos was about sleep, the 10 sleep tips. I'll put the link here for you. And when I did that video, and this is video number 29. So it's one of the early videos that I put on my channel. I'll put a link here for you too, if you want to watch. So when I studied, because for every video that I post on my channel, I have to study a lot. So when I posted this video, I said, okay, I'm not doing this myself. I posted 10 tips to improve sleep quality, to improve sleep efficiency. And I knew I was the first one guilty of those things. So I decided to take my sleep hygiene seriously. I said, if I want my patients to do this, I need to start myself. And then became the pandemic, and then I became on menopause. So around that time, around 2020, I became menopaused, and then I said, okay, everybody says that menopause is, it's really bad for your sleep. A lot of women on menopause, they say your sleep is much worse, you have much more insomnia, you can't sleep. And I said, oh my God, this is only going to get worse. But then I did put those things in practice that I talk in this 10 tips to improve sleep quality. And you will not believe, but now my sleep quality has been the best of my whole life. The best. I don't wake up more in the middle of the night sitting. I don't toss and turn. I wake up refreshed every day, as long as I keep doing those things. And those things are in those 10 tips. But one of the things that made a huge difference of those 10 tips, the one that really, really changed my sleep efficiency. Can you guess what it is? I always share this with my patients. So if you are one of my patients watching this video, you will know what it is because I always tell you what it is. I changed the time that I go to bed. I put an alarm. Well, I don't put anymore, but in the beginning, I put an alarm to go to bed every day, 7 days a week, 365 days a year, at the same time, every day. So for me, that is 10 p.m. Of course, if there's a party, if I have visitors, guests, I make an exception. But other than that, I go to bed 10 p.m. I am in bed every night, including weekends. So then what happens is, and then I put my alarm clock. During the week, I wake up at 6 a.m. So that makes me 8 hours of sleep, right? But I have to tell you, this never happened in my whole life. I wake up every day before my alarm clock. I wake up, 5:45, 5:15, and I'm ready to get up and work and do everything I have to do. And then I just wait. I know my alarm clock will beep at 6 a.m. I just wait, and then 6 a.m. I get up off the bed. This has never happened to my whole life before. So I really am a living testimonial that just changing your sleep habits, your sleep routine, sleep hygiene can make a huge difference. Take your sleep seriously. So if you want to learn about the other 9 tips that I have in that video, just watch that video. It's on my channel. But I have other things to tell you too, because there are many patients who are taking medications for sleep. Let's talk about medications a little bit. So in terms of why do we doctors love to give medications to people who have sleep problems? So I can guarantee to you, if you go to a doctor and you say, oh, doctor, I'm not sleeping well and sleep is really important. I know it's important. Well, why it's important? Because there are many things that happen during sleep. You do need to have a good quality sleep because it's during the sleep that you produce your own pharmaceuticals, your own medications. I call sleep the free medicine. It's during the sleep that you're going to produce your own endorphins, the neurochemicals that you need to manage your pain during the day. It's also during the sleep that you're going to, the garbage trucks go inside of our brain and they eliminate all the junk, all the substances, all the toxic substances that were accumulated in our brain when we were thinking, when we were doing activities, when we were awake. So during the sleep, all those little garbage trucks, they go and clean everything. And if they don't eliminate, let's say that you don't sleep enough, or if your sleep is all disrupted, as I had some patients that they sleep whenever they want, whenever they feel tired, during the day, during the night, they don't have a routine. That's totally crazy. What happens is those toxic substances accumulate in the brain, and then if they accumulate in the brain because you're not sleeping enough and the garbage trucks are not going and clean everything, they produce a lot of diseases, including memory problems, cognitive problems, dementia, Alzheimer's, neurodegenerative, Parkinson's, and all those things that happen are diseases of the brain, including chronic pain. Chronic pain is a disease that we know there are a lot of toxic chemicals that accumulate in the brain. Chronic pain is a neuroinflammatory disease in the brain. It's different. If you feel chronic pain in your back, you may think that your problem is in your back. It's not. It's a disease of the central nervous system. If you don't sleep well, those toxic substances accumulated during the day are not being cleaned up, and therefore the problem is just accumulating. That's why sleep problems make pain worse, and pain makes the sleep problems worse, so they feed each other, okay? So going back, why do we doctors love to prescribe medications to patients with pain? First is because a lot of doctors don't have time to talk to patients about their sleep hygiene, right? They don't have time to discuss these things that I'm discussing here with you. See how long it's taking. It's taking me already 25 minutes to explain to you the things that I want you to learn about chronic pain. And sometimes even I don't have time in my own clinic to explain all of this. That's why I have my YouTube channel. I tell them, watch this video on my channel, so then you'll learn more from me. But if we don't have time, it's much easier to give a prescription, unfortunately. And the medications will work? Yes, they will work. They will make the person more sleepy, but they may have other side effects. I don't like to prescribe benzodiazepines for people who have chronic sleep problems because they will become addicted. They will become dependent on benzodiazepines. Even the Z drugs like zopiclone, zolpidem, those medications. There is one medication that I prescribe more often for sleep if the person is already, so this is how I manage my patients with pain. If they are doing the sleep hygiene, tell me that you are doing all those 10 things that I recommend in that video, okay? If they're doing the sleep hygiene, they are already going to bed every day at the same time, they are avoiding light in the bedroom, they're avoiding noise, they're keeping the temperature of the bedroom cold, they are avoiding exposure to artificial computer light or tablets or iPhones or cell phones. That light stimulates the brain. They are not having big meals at night, they're not drinking alcohol, they are eliminating caffeine. Stop taking caffeine. If you want to have a good, I'm not talking about reducing caffeine. I'm talking about stop caffeine if you want to sleep well. Even if you take 1 cup of coffee in the morning, that will be still present in your blood at 3 o'clock in the middle of the night. Did you know that? Okay. So you may drink decaf coffee, okay? Or you may drink tea, herbal teas that don't have any caffeine. Change your habits. Some people don't have problems. Some people drink coffee and they sleep well. Good for you. But if you drink coffee and you're having sleep problems, stop. And don't stop abruptly. Because if you stop abruptly, you're going to go on withdrawals. Reduce, and then stop. You'll see huge change in your sleep quality, okay? I talk about this in the video, the 10 tips. So if you want to change those habits, you're doing all of this, but you are still not sleeping well, I may prescribe some medications. And one that I usually start is amitriptyline. Amitriptyline is in the class of antidepressants. I'll put a link here. I have a video about amitriptyline. It's video number 74 on my channel. And I talk about amitriptyline, the side effects, what are the doses, etc. I use a very low dose for people who have chronic pain and sleep problems. It's not addictive. The person can stop whenever they want. They will not become dependent on amitriptyline. So those are, why doctors prescribe medications, but try to stay away from benzodiazepines and Z drugs like zolpidem, zopiclone, because they create dependence and then it's really hard to stop taking them. And the other thing is also, they may make the person fall asleep quicker, but it doesn't give a better quality of sleep, okay? The other thing is, don't use alcohol to improve your sleep. Some people may manage their sleep problems with alcohol because they feel more relaxed and they fall asleep quicker. But this alcohol, by the middle of the night, after 4 or 5 hours, is going to go, it stays in the brain. First of all, it's very toxic to the brain. So when your brain needs rest and your brain is trying to remove all the toxins that you produce during the day with those little garbage trucks, you're giving alcohol to your brain, and then you expect your brain to clean the toxins? Doesn't make sense. That alcohol in the middle of the night is going to disrupt totally your REM sleep, your phase 4, stage 4 sleep. It's going to give you a horrible quality of sleep. So don't use alcohol for sleep, okay? So this is really important that we know that every person needs a different amount of sleep. But we know for people who have chronic pain that the right amount is somewhere between 7 and 9 hours of continuous sleep. I have patients, as I said here, and in my book, this book here, the third step is sleep. So, and in this book here, I mentioned a case. So the 8 steps, if you remember the 8 steps, they go from here to here. The third step is so important, is getting quality sleep. And in this chapter, I talk about a patient that I had, and I see so many patients with chronic pain. And a couple of weeks ago, I saw another patient with exactly the same thing that I wrote in this book here. They go to bed whenever they feel like. Like if 3 o'clock in the afternoon, they feel sleepy, they go to bed and they sleep for an hour. And then they wake up, and then 6 p.m., they're tired again, and they go to bed, and they sleep for another 2 hours. And then midnight, they're not sleepy, so they stay awake from midnight to 3 a.m., and then they go to bed again, 3 a.m., and they sleep another 2 hours. And they tell me, oh, doctor, I get 8 hours of sleep every day, but it's not continuous sleep. And if it's not continuous sleep, you're not doing any favor to your brain. You're just damaging all these neurotransmitters. You need to go to phase 4. You need to have REM sleep. We have a circadian rhythm. Our body is born with a clock. Inside of our brain, there is a clock that tells us we have a rhythm. And this rhythm goes every 24 hours, repeats itself. So there are hormones that are produced early morning. There are other hormones that are produced 6 p.m. There are other hormones that are produced 8 p.m. So we have this circadian rhythm. If you're messing up with your circadian rhythm, what do you expect me to do for your sleep? What do you expect me to do for your pain? If you're feeding your chronic pain, do you expect me to give you magic medications and give you a recipe that will get rid of all of your pains? It's not going to work. No injections, no medications for pain will work if you're messing up with your sleep. Please do your part. So if you're doing your part, I can help you. But if you're not doing your part, I cannot help you. We also know that too much sleep, so I told you it's between 7 and 9 hours of continuous sleep. I also have a video I posted recently, let me see if I find here, that talk about too much sleep. Here, it's video number 199. What happens if you sleep more than 9 hours? It's also bad for your sleep. It's also, for your pain. It's also bad. Sleeping too much, more than 9 hours continuous. And I know this I know this from my own experience. Some days I sleep in. Like I don't wake up at 6 a.m. and I wake up maybe an hour, 2 hours, 3 hours later. Oh my God, everything hurts. All the muscles from here to my bottom of my foot hurt. And I know it was just because I stayed in bed too long. What if you can't find a sleep position? So for those of you who have chronic pain and you are not finding a position to sleep comfortably at night because maybe you have some musculoskeletal problems, some joint problems, some arthritis, I have a video for you. So that's video number 70, okay? And lastly, for those of you who are having problems with sleep because of worries, preoccupations, fears, depression, anxiety, so more mental problems, and you need to learn how to relax. You need to learn how to meditate. This is excellent. If you meditate before bedtime, instead of watching videos, instead of watching a movie, instead of playing video games, don't do that because that stimulates your brain even more. If you learn how to meditate, relax, do some mindfulness, breathing exercises before bedtime, I have a course for you. So here on YouTube, you can go to this link, and this is a paid course because I created a playlist, and the playlist has many different videos. You can choose the ones. They don't have ads, okay? So they will not be stopped by advertisements. They go ongoing. So that's why it's a paid course, because they don't have ads. And once you buy this course from YouTube, you can access those videos forever and ever. And you can play, replay, you can keep them on your cell phone and listen before bedtime. And you can even in your YouTube settings, if you like one of those videos in the course, you can set up your YouTube, say, keep replaying this video. So it will, at the end of the video, it will start again and start again. Maybe you fall asleep, you don't even notice. You can also set up your YouTube on settings. If you like that video and say, YouTube, stop this and shut off the YouTube, so YouTube will shut down at the end of the video, so it's not going to keep showing you more videos. Okay, so there are a lot of settings on YouTube. That's what I like about this one. And so then you can, I have relaxation, breathing, muscle relaxation, progressive muscle relaxation. That is excellent to help people to relax their mind and help them with insomnia and fall asleep. And of course, I have my books, the 2 books. This one, the third step, the 8 steps. The third step is about sleep quality. And my new book, You Are Unique and So Is Your Pain, is excellent if you want to have more reflection. So this is more like a daily journal for you to reflect on things that are perpetuating your pain, things that are working. And this is for you to write and do some exercises daily. There are 90 exercises. So if you do those exercises every day, in 3 months, you will be finished the book. Those are the things that I wanted to tell you today. Let me put here a link to the books on Amazon. If you want to order them anywhere, you can order them from any online bookstore, but they are available for you to purchase in Canada here. The Chapters Indigo have both of my books on the shelves. I would love to see if you like those books. And if you bought one of my books, please write a comment in the store where you bought it. You can go there, rate my books, and write a comment. That will really help other people who want to learn more about what the books are about and help them to make a decision if they should buy a book or not. Let me just see here. Did I say everything that I wanted to say about my videos? I have also another video here, video number 201, that I talk about what comes first. Is that the sleep problem or pain? Because a lot of people tell me, Dr. Furlan, my sleep is bad because I have pain. And I say, it might be the reverse. You have pain because your sleep is bad, because they feed each other. So video 201 is about this topic. What comes first, sleep or pain? So it was a pleasure seeing and talking to you today. This video, once I finish this live, this video will be editing. YouTube will edit my video and it will be available for you to rewatch later. And so then you can learn more about sleep and pain. I hope to see you here next week. I'm trying to do this every Wednesday. Let's see if I can do this, and see you next week. If you have any suggestions for topics for next week, just type in the comment here. Good to see you all. Goodbye.